Good morning. We're here on this virtual Facebook Live with Dr. Joel Fernandez with USF Cardiology. Thank you for joining us, Dr. Fernandez.
Thank you, Michelle.
We appreciate your time this morning. I think cardiology is a really important issue in the COVID-19 crisis, so we appreciate your time.
Yes, it is. Thank you. Yeah.
So if you suspect you have the virus, we'll get right into it, and have cardiac issues, what symptoms should you pay special attention to? What should you be on the lookout for?
Yes, Michelle, if you have known cardiac issues, such as hypertension, coronary disease, prior heart attacks, heart failure, or significant valve disease, if you suspect you have been infected, the main step would be to confirm that you're infected or not. But as far as the heart is concerned, you look out for exacerbations of your own problems, such as chest pain, new or unusual chest pain or chest pressure, and also shortness of breath, new or worsening shortness of breath. Those are the most common symptoms that may show up.
Okay, makes a lot of sense. There's a lot of conversation about at-risk patients and how at-risk patients should not only practice social distancing, but physical distancing, stay at home. Who are the at-risk patients from a cardiac standpoint?
Okay, very good. Yeah, that's a very important question. And risk in this situation that you're living and regarding cardiac patients, it means that patients with heart conditions are at higher risk of developing severe or critical illness with COVID-19. That if they actually get infected, then compared to a completely healthy person, a person with heart conditions, it's been proven they're at much higher risk of developing a worse type of infection, worse shortness of breath, to the degree that it may take them to the hospital or an ICU or a ventilator. That's the high risk that we're talking about. What puts the patient at high risk would be the history, for example, of hypertension. It's been documented in the tests, in the patients that had illness in China, where all this started. They noticed a high incidence of or high prevalence of hypertension in these patients that did poorly, as well diabetes mellitus, renal, chronic conditions, and problems with heart failure and coronary disease. If those conditions are present, then upon being exposed to the virus and being infected by the virus, there's a higher risk of developing a worse disease and worse outcome. So patients need to be very careful avoiding the exposure.
Sounds like good advice. If you have heart disease, you're at a higher risk for contracting COVID-19. When we spoke with Dr. Berlowitz a couple weeks ago, he said that probably 40% of the patients that are going to contract COVID-19 and be hospitalized have heart disease. What are some things that you would recommend to patients that have heart disease to limit their risk of exposure?
Okay, so the number 1, number 2, and number 3 steps would be social distancing. That is the main proactive advice and proactive action that the patient can take, is just avoid the exposure. And it's the only thing you have under your control. It's trying not to be exposed, avoiding groups, right? Because of avoiding contracting it from other patients, avoid unnecessary outings. And very important, because it's been proven, wash your hands properly and clean and disinfect areas of high touch in the house, like doorknobs, countertops, refrigerator handle, microwave, the toilet, these things that we take for granted. But if we do a very, very good job at continuously cleaning them and washing your hands and social distancing, it's really the best thing we can do, and we can control most of that.
Terrific. It's a good answer. One of the things that's really been talked a lot, especially across the national media in the last few days, is mental health awareness and how stress and change can put a real strain on your heart. What can people do? What would you recommend a person do personally to avoid these types of stressors to keep that strain off their heart?
Yeah, that's excellent. It's a very good and important point, because this is not happening quickly. Our response to this situation, right, is lingering, and it's putting mental stress and physical stress on everyone. So it's important to learn how to deal with that the best possible way. Um, the main thing will be patience. Patience, uh, remain calm. The stress will be there, right? The stress will be there, but what we have to concentrate on is how we react to that situation of the virus, of the news. Um, so let's remain patient, let's remain calm, and be accepting to the current reality, really, because it's out there. Uh, and let's do what the medical experts um, advise, and try to not get overloaded with information all day long. People in general, not just patients, but people in general should try to develop some type of routine in their day within the social distancing. It's not easy, but it helps a lot. Form your own routine. Uh, it's excellent time for self-care. Take care of your body, uh, meditate. There's plenty of time, obviously, and just proactive self-care. At some point, this will be over, or it will be much better, and we need to be in a better place at that time. Uh, yeah,
That's great advice. I think that all that's really true. Self-care and just relax, maybe do a little Netflix.
absolutely, absolutely.
So, what do you need to know about the coronavirus if you have heart failure? We're really concentrating on the heart, and as a cardiologist, you're an expert in this field. But what are a couple things that we need to know about if people have heart failure?
Yes. Um, if you have heart failure, like we said, you're at higher risk of developing more severe illness from COVID if you catch it. So again, the point of avoiding exposure to others is the number one thing. Um, but it's also important to know that the virus, it predominantly affects the lungs, right? But it can also directly attack the heart. Um, and in that case, it produces inflammation of the heart, and the patient will not be able to ignore the symptoms. There'll be chest pain, and the patient will be feeling ill. So at that point, there's nothing you can do to avoid it, just to be aware of a change in your condition, new chest pain, new shortness of breath, and feeling ill. It may prompt, for sure, a call to your doctor or a visit to the hospital at that time. Um, if you have heart failure, make sure your medications are up to date and you have enough refills in case there's any interruption of care because of you feeling ill or family member not available at that time. Also, nutrition is super important. Stay healthy, stay with a balanced nutrition, and avoid high salt content. Since we're staying at home all day long, we may be tempted to grab a lot of snacks and things of that nature, but uh, try to be more vegetables and fruits. Okay, balanced meal, and keep a good communication with the office. We're still there to take care of you one way or another, either by phone call or telehealth with video many times. We're there to take care of you and keep communication with the office. We'll find a way somehow to help out if it's necessary. And be aware of changes of your own body, new symptoms or worsening of symptoms.
And you've been doing some telehealth calls with patients. How are those
Correct.
going? How are those going?
Yeah, patients are very appreciative, and we've been pleasantly surprised that it actually makes a difference. It's way different than not having contact with the patient at all. So it's the best tool we have right now, and we're making progress on it. So it's available and it's helpful.
Terrific. All right. Well, thank you so much for your time. You've given us a lot of good advice. I hope our heart patients and their families are taking your advice to heart, and we appreciate your time.
Thank you, Michelle. It's a pleasure.